That's like a referee and the player being on the same team, Kansas City. Cigna just said they're ending drug rebates, the thing critics literally call kickbacks. So, is this actually going to make meds cheaper for real people, or is this just PR? So what they're saying is starting 2027, instead of doing secret backroom rebates, they'll just give you the discounted rate at the counter. They're claiming people on high deductible plans could pay about 30% less per month on certain brand name drugs. That mainly helps people who are paying cash towards a deductible or towards a high deductible. Right now, those people pay full list price, even though the PBM already negotiated it down behind the scenes. Cigna is basically saying, okay, you get that lower price immediately, which is not nothing, but here's what most people don't realize. Cigna's PBM, Express Scripts, is actually owned by Cigna itself. Same story across the entire industry. CVS owns Caremark, United Health owns Optum Rx. So the same company that sells you insurance also runs the middleman that decides which drugs are covered and what price you'll be paying. That's like a referee and the player being on the same team, Kansas City. So when they announce a new pricing model, it's still happening inside the same corporate ecosystem. Let's be honest, PBMs are under federal investigation for using rebates in a way that drives up list price. The FTC is all over this. Lawmakers are calling it a kickback system. So Cigna is getting ahead of regulation and saying, look, we're fixing it ourselves. That's smart PR and really good timing. This doesn't touch Medicare or Medicaid. It doesn't force drug makers to drop their list price. And Cigna's PBM still decides which drugs you're allowed to save on. So this isn't drug prices are fixed in America. It's actually Cigna is managing optics and giving relief to a slice of their members. Is it better for some patients? Sure, yeah. Is it the end of the drug pricing game? Absolutely not. Here's the good news. Once one major PBM normalizes showing you the real price at the counter, the others usually follow. And that's really the first crack in the wall.